Hi, my name is Bridget Smith. I also go by Birdie. I will be presenting on polycystic kidney disease, also known as PKD, more commonly. So our chief complaint is feeling pain in the lower back. And for our subjective, we have a 32-year-old patient presents to office complaining of feeling pain in lower abdomen and flank quadrant for the last week. According to the patient, she has had discomfort while peeing and reports having 2 UTIs in the past 2 months. She points to her left and right flank where the pain is located. When flank is massaged, says it is very tender and rates the pain at a 6 out of 10. She takes ibuprofen for the pain, but it comes back the next day. Patient recalls having mild headaches and a slight increase in the size of abdominal area, but relates it to the food she consumes. She has been on medication for high blood pressure for the past 6 months and takes leisure walks after work, but since pain has started, walks have not been as frequent. So for our patient history, we have the medical side, which she currently takes ACE inhibitors for her high blood pressure, and this is just medication. For her family, her mother was diagnosed with high blood pressure at age 45 and passed away at 60. Father has atherosclerosis and was diagnosed at 50, and her sister recently was diagnosed with having kidney stones. For social, she currently lives with her sister and her dog. So a question based on the following, which best describes the symptoms of polycystic kidney disease? A, increase in waist circumference. B, experiencing minor headaches. C, frequent UTIs, high blood pressure, and mass in flank area. Or D, not being able to go on leisure walks due to on and off pain. And I'll give you guys a little bit to think about which answer is the best fit for PKD. So it's C. It's definitely not A because increase in waist circumference, although it is an indicator, this also could just be due to increase in weight gain. Doesn't always have to do with water withholding. Experiencing minor headaches. I mean, headaches are very, very broad. A lot of us get headaches every day. But yeah, it's not a very big indicator, but it is a sign. D, not being able to go on leisure walks due to on and off pain. That is very subjective to our patient, something that she isn't able to do due to her symptoms. So C, frequent UTIs, high blood pressure, and mass in flank area are the best fit for PKD, sorry, and we'll be going over why. So what is polycystic kidney disease? PKD is a genetic disease caused by mutation in genes, and this causes cysts to grow in the kidneys, which can damage the kidneys and make them much larger than normal. There's two other names for PKD. One is autosomal dominant polycystic kidney disease, also known as adult PKD. It's onset later in life, rather than the autosomal recessive polycystic kidney disease, which is also known as infant PKD because it begins in utero. The child or the adult, they can't really help from getting PKD. The prefix and suffix of polycystic is poly means many and cyst means bladder or fluid-filled sac. Ic means pertaining to, so very on the nose for polycystic. So associated and typical symptoms, 9 out of 10 with PKD have the dominant PKD. So it's later in life that they get it. Their recessive is much less common. Adult PKD symptoms start between age 30 and 50. So as we saw in our patient, she's 32, has hypertension, so high blood pressure already, and is already getting a lot of the other symptoms for polycystic kidney disease. And this, as we said, is a genetic disorder. So it's a change in the gene of PKD1 or PKD2 and does not skip generations. So this means that one or both parents had the mutation. So if one of your parents has it, you have a 50% chance of getting it. If both of your parents had it, you have a 75% chance of getting it. And the other end of the 9 out of 10 is the 1 out of 10 people with PKD do not receive it from either parent. So it's a very small percentage, but it is still a percentage of people that can get PKD without having it from either parent. So there's some signs from the symptoms. There's pain in back and sides, which we saw in our patient. Headaches, very reoccurring, could be from all the achiness And then high blood pressure, as we said, a lot of the hypertension issues. And then blood in the urine, recurring UTIs, and kidney stones all have to do probably with the filtration that's being inhibited from the cysts. So a lot of urinary withholding, not a lot of filtration of waste products, and that can cause a lot of, like just UTIs and kidney stones and such. So this is an image of polycystic kidney disease. As you can see, there are cysts on the outside of the kidneys. I don't think they're very large, but I think it's like if you have 2 or 3 cysts at age 30, it's a red flag. If you have like 8 to 10 at age 60, very big red flag. I mean, you're going to keep getting more and more cysts, and you need medication to help at least keep them to a minimum and not have so many, because then you're really not being able to filter anything with the kidneys. So for a physical exam, you can check the estimated glomerular filtration rate, and if it declines below 5 milliliters within 1 year, that means you're not excreting a lot of urine. So that's a big red flag for doctors. And then has the volume of the kidney increased? Has the length of the kidney increased? So this is the Mayo Clinic chart. As you can see, 1C, 1D, and 1E are all in the not great category. You're at high risk because it's how big your kidney has gotten since they last weighed it, or even the length of it. So how much, that can be due to the cyst. It's just growing. It's carrying a lot of excess fluid. Not a great sign. There's also independent risk factors, as I said, the mutation, overweight, so BMI, not great. You're not keeping a lot of those waste products to a minimum, so it's better to not have a higher BMI. Hypertension before age 35, as we saw in our patient. Urological events, so cystic infection, flank pain, proteinuria and microalbuminuria, which are just proteins that help carry things within your blood. Family history of PKD at or above, god dang, 58. So as we saw with her mother, her mom probably had undiagnosed PKD. She had a lot of problems with her kidney. So yeah, that could be an issue. Like, as I said, it is a genetic mutation. So her mother probably most likely had it, and she's also a carrier. So some lifestyle questions to ask while you're doing this physical exam is, do they take any other medications? As we saw, she takes ACE inhibitors for hypertension. A lot of times medications may compete with each other. But yeah, I don't think ACE inhibitors would be a big problem for this particular disease. Do they drink grapefruit juice? As we saw, or as a lot of us know, grapefruit juice is an inhibitor of a lot of medication. It messes with pH of the stomach, which also can inhibit absorption of medication. Do they have anuria or incorrect urinary outflow obstruction? So as we talked about, a lot of the things in the kidney are not being excreted. They're being withheld. So that can cause not great urinary outflow. They're not peeing most frequently, not getting rid of waste, excess of anything in the body. So it could be a very big vital sign. Unable to sense or respond to thirst. And because they are withholding so much urine, maybe they're not getting those signals to drink water or to drink anything really. There's some appearance factors you can look for with polycystic kidney disease. One is jaundice, so that's yellowing of the skin. That may be from not being able to like absorb much or have anything excreted. Hypertension, abdominal mass, and lumbar quadrant or flank with tenderness. So again, the kidney being larger. Pitting edema in lower or upper extremity. So edema is basically just when osmosis is doing its thing. You're having excess fluid being held in the skin. So like it looks like it's twice the size. So if you're looking at someone's ankle and it's quite large and they probably have edema and you push your finger into it, there can form a pit from your finger being pushed into it. So that's again having to do with the sodium fluid not doing its thing within the cells. So there are some treatment options. One is being prescribed this newly approved FDA drug. It is not shown to cure polycystic kidney disease, but it has been shown to slow the growth of cysts and kind of help kidney functions. So this is also like you need to test the patient for if they may have an adverse reaction to it. But if not, this may be a good prescription. It's one of their options. There's non-surgical, so again, eating a healthful diet, keeping that BMI lower. And then also I found a organization called PKD Cure. They help people with polycystic kidney disease, help family members who are caring for those with it. A lot of parents that may be having to take care of their child. But yeah, it's a great organization. They educate people, help them with any dialysis needs, support mentors, a lot of great information from them. And then there's also surgical. There is no known surgical cure for PKD unless you're trying to get one of your kidneys removed. Up to you. But there is hemodialysis and peritoneal dialysis, which I'll be talking about. So the two dialyses are hemo, which a lot of them call just hemodialysis. That's when they're taking a machine to clean waste from the blood. So it's an artificial membrane and it's permitting waste molecules to pass into the fluid and be removed via the blood. So as we can see, there's a dialysis fluid going in. You're then going through this, giving them clean blood, and then that goes back into a used dialysis. It's just removing waste products, or a lot of the time it's urine. There's also peritoneal dialysis, which is it's just a tube that's inserted surgically. So it's removing extra fluid, electrolytes, waste using the lining of the abdominal cavity. And like I said, does require surgery. You're using a catheter, again, removing excess fluid, which will help with that abdominal pressure that they may have or the back pressure that they may have. Totally up to the patient. And then I want to talk about a couple of things I found interesting about polycystic kidney disease. It's sadly, there's no cure. There's really no way of stopping it either because it is a genetic disease. There's just ways to help people live with it, really. And I think I saw a number where it's like 500,000 people in the US live with PKD, which is a pretty large number. So I feel like it's not a very talked about disease, but seems like a lot of people do live with it. Yeah, I had no idea about PKD before learning about it. So it's a very interesting disease to say the less. Yeah, really do appreciate it. So thank you for listening. And if you have any questions, please let me know. I appreciate you for listening. And yeah.